Today's tutorial is on knee taping, and specifically medial ligament taping, but the principle is exactly the same for the lateral ligament. So usually with a grade 1 or 2 type MCL, but someone coming back from a grade 3 as well who's been out for a number of weeks, the principle is exactly the same, you just use a lot more taping. Now normally what we do is tape them from the first session they get back to training right through to probably 6 to 8 weeks after they start playing and feel comfortable with it. I encourage players to keep taping for an entire season, but sometimes it's up to the player and the comfort that they feel. So first thing, we're going to use the Fix 50. I like to use this as an anchor because it adheres to the skin quite well. Just using an anchor on the thigh and as well as the calf. Particularly with males who don't shave their legs, it sticks to the skin a lot better, the Fix, rather than just putting the tape straight on. So just peeling that off. And just going slightly below the knee. Now with the thigh and the calf, because they're not perfectly symmetrical, usually I just try and do it at an angle, so I'm coming up and around it, so you're finishing higher up at the back, and it just helps to lay down a little bit better on the calf and the skin itself. Now the same again with the thigh, starting above the knee, just layering the tape on a slight angle. It doesn't matter if you get some creases here, it's hard to get it perfectly symmetrical, but as long as the majority of it's quite flat, it'll adhere to the skin quite well. For this, we use the 38mm rigid. Now basically the medial ligament, and same with the lateral ligament on the outside, is a ligament that helps the integrity or keeps the joint stable on the inside here. So it pretty much goes from what we call the femoral condyle, and you can feel it, it's a nice little lump if you push through the muscle there, down to the tibia. So we're going to go along that line. So I like to measure it out, start from the top. Now we like to have their knee in a slightly bent position. This shortens up the medial ligament slightly. So layering it on from the top, I then like to pull down hard on the tape and then just lay it on so it's nice and flat. Usually I'll put one straight over the middle of the medial ligament and then fan it forward and fan it back about halfway along the tape from the previous one. And again, pulling on the tape, laying it down, trying to get it nice and flat. And going posteriorly or at the back end, laying it down. Now, grade 1s, I'd usually use 3 sort of anchor type strips to start with, and then just having a crossover through the area that is quite sore. So if they've got a sort of proximal medial ligament tear, what I would do is I'd have the crossover over the top of where the tear is. If it was lower down, I'd have it lower down. So just measuring that up. And we'll say for this purpose, it's right through the middle. So whether you come from the top or the bottom, it doesn't really matter. So laying it on and then pulling it nice and tight. So we're trying to get that cross right through the middle of where the tear is. So laying it on, pulling it nice and tight. And you would do certainly a couple for each side. Just fanning slightly forward and then again fanning slightly back. Now for a grade 1 to 2, that's probably well and truly enough. For a grade 3, and it doesn't really matter how much more tape that you use, as long as the athlete's nice and comfortable with it, I would usually just reinforce over the top of all of that. Until I'd made my way all the way to the back. Okay, so that's the basic principles for the medial. You would certainly do it for the lateral exactly the same. And then just to anchor it all off using the hand tearable, it's a lot more stretchier. just to anchor it all off. Just helps to keep all that tape down, and it actually goes around the knee quite well. So just starting, whether it's from the bottom or the top, it doesn't really matter. Going around the calf, just being careful when putting the stretch tape on is not to pull it too tight around the thigh or around the calf. It can restrict the blood flow, and the last thing you want is your athlete to be uncomfortable because their foot's gone numb. So laying it around, you usually do a couple of strips, and then, and this is the good thing about the hand tearable, it sort of conforms to the, when you turn it, it conforms and sticks down quite well. So we're going over the top of that tape, around the thigh, and then crossing it over again. And finishing it off. And just finishing off with a bit of rigid tape just to stick those edges down. And that's our medial ligament.